human skeletal system, there are two basic types of skeletal system. One we call axial skeleton, other one we call appendicular skeleton. In human skeleton, there are two types of skeleton. One we call axial skeleton, other one is appendicular skeleton. In the axial skeleton, it is included our skull, our vertebral column, our ribs, and the sternum bone. These four are, look at this picture. You can see the skull. This is our skull. Skull is coming under axial skeleton, and vertebra, vertebral column. Vertebral column is coming under axial skeleton. This bone, the chest bone, what is in the center of our chest, called sternum, comes under axial skeleton, and the ribs are also coming under axial skeleton. Only these four components are coming under axial skeleton. Okay. Passing the idea, the rest we will discuss later. Skull. If you take human skull is kept on the vertebral column. It is the vertebral column that gives support to the human skull. Our skull is moving on the vertebral column. If you take human skull is made of 21 bones. In these 21 bones, okay, if you take these 21 bones, these bones are connected to each other, joined to each other by ossified joints. If you want to get an idea regarding these joints, okay, in the skull, you will see stitches like units, stitching like. Okay, small stitches like. And this stitching component, here I choose a picture to show you that. Here in this human skull, you will notice in these places stitches like. Here one is coming, another one is going like this. Like this, they are the ossified joints. These ossified joints are called by the name sutures. These ossified joints are called by the name sutures. Sutures cannot move. Sutures cannot make in the joint. You can see it here, the zigzag like components here. The other sutures, your book is telling those sutures are ossified joints. In the human skull, we identify two divisions. One division is cranium, other division is face. Cranium includes these bones. What are the bones? Read, will you?
Frontal bone.
Frontal bone.
Two parietal bones. The occipital bone. two temporal bones, the ethmoid bone, the sphenoid bone.
So here frontal bone is given in singular. Then how many bones are there? One bone is there. Two parietal bones, correct? And
Yes.
one occipital bone, temporal bone, two temporal bones are there. Ethmoid bone, one bone is there. Sphenoid bone, that is also one bone is there. Then all together, 1 plus 2 plus 1 plus 2 plus 1 plus 1, all together, how many bones? How many bones making the cranium?
8 bones.
8 bones. So here it is made by how many bones? 8 bones. Out of 21 bones, 8 bones make the cranium, means remaining 13 bones make the face.
Face.
Are you clear?
Clear.
Right. In the bones, we are introducing here one by one. First, we are introducing the frontal bone. The frontal bone makes our forehead region. Okay, up to the eye orbits. You can touch your eyebrows and see your eyebrow bones and the bone inside the upper part of your eye orbit, your front forehead bone. That is which bone? Frontal bone. What is shown here in the green color? The green color highlights it. The green color highlights and show you, okay, this is the frontal bone. Showing the frontal bone in different views. Another bone, parietal bones. That is the truth, correct?
Yes,
it is
sir.
making the side, okay, behind the frontal bone. There are two bones there. The two bones are separate, okay, joined here by the suture marks. Here we have the suture marks. The two bones are joined together. Two parietal bones are there. Parietal bones in the sides, it will be looking like this. From the top view, okay, I have given 4 pictures to show you the different locations. Here the sutures. Two bones are there, right and left. Right and left parietal bones are there. Coming to the occipital bone will be located in the back part of us. Okay, so this is the location for our occipital bone behind. Okay, it is going to the bottom part of our skull. In the bottom part of the skull, in the occipital bone, there will be a hole, and that hole is called foramen magnum. The hole is called, what is it? Foramen magnum. It's a hole. Through this hole, the initial part of the spinal cord exits from the brain. So the whole foramen magnum is situated in the occipital bone. So occipital bone is 1. Thereafter, temporal bones, actually temporal bones they are, okay, surrounding our ears, in our ear region, there are one pair of bones, one on the right side, one on the left side, one pair of temporal bones are there. Passing that one, sphenoid bone. In this picture, you can see a yellow color bone there. This yellow color bone, okay, Actually, the greater part of this yellow color bone can be noticed inside the skull. Cutting the skull, if you go in, cutting the cranium, if you go in, inside the skull, you will see this bone like a flying bird. The bird has two wings, right wing, left wing. The ends of the bird wing, can be noticed here. This place coming out, that place is coming out and shown to you on the right side and shown to you on the left side. So that is sphenoid bone. So how many sphenoid bones are there? Sahika?
2.
2. You notice 2 sphenoid bones here?
1, sir.
1. 1 looks in what shape?
Flying bird.
Flying bird. The bird's wings can be seen in either side of your skull outside. Is that mean there are 2 sphenoid bones because
No.
you see it from both sides? No. Interiorly, there is only 1 sphenoid bone. The bird's wings can be noticed in either sides. Are you clear?
Clear, sir.
This is the last one, this boxed part. Here also you can see that one. Above the bird's head part, there is a purple color bone, and that bone is called by the name, what is it? Ethmoid bone. So like this, you have a normal introduction to all the bones in our cranium. All these bones are bones of the cranium, cranial bones they are. They are bones of the cranium, or they are the cranial bones. Right? Rest of the bones are belonging to the human face. Rest of the bones are belonging to human face. Here, this picture somewhat try to show you the bones of the face. Here, I will try to give you the name of these bones. This is our lower jaw bone called mandible. Mandible. It is our lower jaw bone. Okay. In the mandible, okay, mandible or the lower jaw bone is the only bone in our entire skull that can move. Others cannot move. Okay, this bone is called maxillae. Maxillae. It is the upper jaw bone. So maxillae is the upper jaw bone, and mandible is the lower jaw bone. Right? So how many mandible, how many maxillae? Look at the diagram.
1 mandible, 1 maxillae.
1 mandible, 1 maxillae. Now out of 13, there is 1 mandible and 1 maxillae. Now altogether, there are
2.
13 bones there, correct?
Yes, sir.
In the 13 bones, one maxillae and
One man.
one mandible. Now, introducing you the third bone. This blue color bone, that is called zygomatic bone. So look at the diagram. How many zygomatic bones are there?
2.
2. Okay. 2 zygomatic bones are there. Okay. Similarly, here there are actually in this place there will be a tiny separation like this. Okay, a separation like this. The yellow color bone is nasal bone. Nasal bone. So how many nasal bones are there?
2.
2 nasal bones are there. So for the moment, all together, how many bones we have introduced?
6.
6
bones.
bones. So out of the
13 bones.
13 bones, okay, exactly 6 bones we can notice from outside. Understood?
Yes, sir.
So another how many bones are remaining?
7.
7 bones are remaining. These 7 bones are not be able to notice from
Outside.
Okay, we have to get into the space to see the rest of the bones. Anyway, one more bone we will try to show here. Okay, it is this bone. This bone. This bone. It is the lacrimal bone. Lacrimal bone. Lacrimal is a word we apply for tear. So tear glands are called lacrimal glands. So this is lacrimal bone. Clear? Now,
Clear, sir.
how many bones? 2
8
lacrimal bones, correct? 2
Yes, sir.
nasal bones, 2 zygomatic bones, okay? 1 maxillae, 1 mandible, correct?
Yes, sir.
Okay. Rest of the bones we have to go inside and see. Right. Anyway, as you don't have the tute, anyway, I will today upload the video, the class video now, correct? After getting that, take that, you print out and label it. Okay.
Okay, sir.
Right. Thereafter, here, the order is coming. 2 zygomatic bones. Okay. Maxillae, 1. Nasal bones, 2. Lacrimal bones, 2. Correct? mandible 1. I have introduced you this bone. I have introduced you this one also. This is also introduced. This is also introduced. This is also introduced. Name wise, I have introduced you 5 bones. Zygomatic bone, maxillae mandible, nasal bone, and the lacrimal bone. Now, who are the remaining ones to discuss? 3 bones there. What are the 3 types of bones?
The vomer,
The vomer,
the 2 palatine,
the 2 palatine bones,
2 inferior concave.
the 2 inferior concave. These are the bones we have to discuss. This picture shows you the 2 palatine bones. Okay, you have to see the palatine bone by traveling into the mouth. Okay, the roof of the mouth has these ones. These are the which bones?
Palatine bones.
Palatine bones. Understood? So in this picture, you can notice there are how many palatine bones?
2 palatine
2
bones.
palatine bones. So palatine bone only you have to mark in this picture. Right? Now introduced palatine bone also. Now 2 bones are to be discussed. One it is, what is it? The vomer. Other is the inferior concave. One it is the vomer. Other one it is the
Inferior concave.
inferior concave. If you see the vomer, actually little difficult to see the vomer from exterior of the skull. This is how the vomer is situated. Vomer can be reached through our nose, right? Can you see the vomer? Okay, and that is the vomer bone. Okay, vomer bone. It is actually that bone. You can see the vomer bone, correct?
Yes, sir.
That
Sir,
the
that
bone.
can be noticed from the outside, no, sir?
It cannot be clearly noticed from outside. Okay, that depends on the skull. Some skulls you can't observe them very clearly, although it is shown in that one. Some now see the book. You might think the separating part now. Okay, now what he has in the hand by removing the vomer, that is the vomer bone. Sometimes in the skull you can see that one. Here, this lower part. Remember, most of the us we think this upper part is there. No, it is the it's 2 separate pieces. You will be seeing that one as a single piece. Right. Anyway, if this picture is okay to show you the concave. Okay, concave bones. Concave bones. Okay, concave bones. We have to now see how they look like. Okay, which concave? Inferior
Concave.
as inferior concave. Inferior concave bone. Little challenging bone to be noticed from outside. Okay, when they highlight and show you like this, you might that will be there. Understood? But when you take a real skull, little challenging to see that bone. Inferior concave. Like as I told you, you can access those bones through the nasal cavity. Understood? Femur also can be accessed from the nasal cavity. Can you see this bone?
Yes, sir.
Inferior concave. When they take like this, we are like, yes, that inferior concave. That will be there with us. Understood? So like
Yes, sir.
this. Now, when you are given this skull, you will be somewhat be identifying. Okay, this is going to be the inferior concave. Correct? Is it correct?
Mm,
Okay. Here, this place is going to be the
Warm.
warmer. So like that, we are able to little identify those bones. Right. Anyway, the name introduction only they are in the syllabus. Now, inside the cranium, okay, there is the brain case. You can see this picture. Okay, in this picture, you can see this is the brain case. Understood? Who will be
Yes.
accommodated inside this brain case? The brain.
Brain.
Okay. So brain case has a capacity. Brain case has a capacity about 1 point, what is it? 5 liter. So 1.5 liter content can be situated in the brain case or the cranium. Okay. The main work the cranium does is it protects and encloses the brain. Same time, these ones are also protected by the cranium. What are the things? Inner ear, middle ear. They are protected by the, really, they are protected by the temporal bone. Olfactory organ is protected. In the eye orbits, eye orbit is made with the contribution of many bones. In the eye orbits, eyes are protected. Okay, without using the word eye orbits, they are using the word, there is a bony eye socket. This bony eye socket, one side protects the eyes. Other side, it provides place for the eye muscle attachment. Exterior muscles are there. Those exterior muscles are attached to the eye orbit bones and show movements. Horizontal movement, vertical movement, rotational movement. Those things are there. And I introduce this word to you. What is this word?
Foramen magnum.
Foramen magnum. In which bone I told you foramen magnum is there? Can you remember?
Occipital bone.
Occipital bone. So in the occipital bone, foramen magnum is there. Through the foramen magnum, what is the component leaving the brain? What is the component leaving the brain through the foramen magnum?
Spinal cord.
Spinal cord. In either sides of the foramen magnum, two small peanut size structures will be there. Those structures are actually called in this name. What is the name?
Occipital condyles.
Occipital condyles. Okay, these occipital condyles are contacting with the first vertebrae of the vertebral column. What is the bone working as the first vertebrae?
Atlas vertebrae.
Atlas vertebrae. And the skull is moving on the atlas vertebrae, contacted with occipital condyles, showing up and down movements. That means we used to say yes movement. When someone asks, you say yes. How will you move your head? Up and down. Yes, 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 yes. And that movement is called nodding movement. Right. In this picture, I am trying to give you an idea regarding this. What is this one? What is this all called? Foramen magnum. Correct? In
Yes.
sides of the foramen magnum, there are two knobs. What is the name given to these knobs?
Occipital condyles.
Occipital condyles. So how many occipital condyles are there?
Two.
Two occipital condyles are there. Occipital condyles are articulating with the atlas vertebrae and contributing the nodding movement. Clear?
Clear, sir.
Good. So, after getting the printouts, mark those things. Now,
Okay, sir.
now we come to the next heading called, read this name,
Fontanelles.
fontanelles. Okay, when you take a small baby who is in an age less than 2 years and touch the the place in the skull outside, you will notice certain places are very soft. Certain places are very soft. Majorly, this place, this place is very soft. Why it is soft mean? In actually our cranial bones start to develop like a membrane. It is a membrane becoming harder and turn to a bone. Membranous bones there. In the beginning, when the child is developing inside the mother, it is a membrane part. Gradually, that membrane part is becoming harder, 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 harder. The skull is becoming harder. When the child is born, certain parts of those membrane bones are not yet harder. And those places are called fontanelles. Fontanelles, if you touch, you will notice it is a softer place. Okay, after 2 years' time, gradually the fontanelle portion will become harder, 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 and finally, now in you, in me, can we expect fontanelle?
No.
No. So, what is the benefit of fontanelle? Actually, the fontanelle is helping the mother in the childbirth process, the parturition process. The natural birth of a child is through the vaginal canal. Vaginal canal is not a bigger one. Okay, somewhere I have studied vaginal canal has a diameter. Okay, vaginal canal has a diameter about 6 centimeters. 6 centimeters. Somewhere I read it. Vaginal canal has a diameter about 6 centimeters. Okay, so comparatively, sometimes it can be less than that. 3 centimeter like also. Point it is, now the child head part is going to pass through the vagina. Mother, in the pain of labor, she is pushing the child through the vaginal canal. In that time, if the cranium little compress and become small only, the parturition will be easy. If it is a harder material, one side, mother will be getting lots of trouble. On the other side, there is one opportunity. The cranium of the child can crack. When too much of force is put on it, small softer skull no, easily can crack. So these fontanelles help the cranium to little get compressed and easily pass through the vagina. If it is a caesarean birth, no, these issues are there. Okay. After birth, in 1 or 2 years, little by little, that place will become a harder bone. Then there will not be any fontanelle. Okay. Immovable joints are present between the skull bones to provide more protection. So actually, until fontanelles become harder, okay, we should be very careful. Otherwise, sometimes it can create deformation of skull or cranium. Cranium can be deformed. One side will be larger. Okay. I have seen such experiences in the children. Okay, some places will be larger. These are showing some extraordinary things, not like that. Okay, so deformation, one side of the cranium will be larger, the head will not be regular in shape. So until they become harder, we should be careful. Are you clear? Right. In the skull, there can be many fontanelles, but none of their names are in your syllabus. Although this picture I have given you, in that one, anterior fontanelle, posterior fontanelle, like words are there, none of them are in your syllabus. Okay, if you get to know the overall function of the fontanelle, that is much more enough. Okay, coming to the next one, that is regarding the sinuses. This word is very familiar among us, sinuses. Our people say, I have sinus problem or I have sinus. Okay. Actually, what is this sinus mean? They are air-filled cavities. What are they? What are they?
Air-filled cavities.
Air-filled cavities. These air-filled cavities, okay, are in contact with this nasal cavity. Understood? With this
Yes.
nasal cavity, they are in contact. Air entering through the nasal cavity will be filling those cavities. Okay, because air is filled on those cavities, we feel the head as a light material. We don't feel our head is a heavier material. Actually, our head is a heavier material. But we don't feel that. That is because the sinuses are there. They are filled with air. In our syllabus in truth also, sinus can be noticed in 4 bones. You can see the names of those bones. Sphenoid sinus. That is located in the which bone? Which bone? Sphenoid bone. Frontal sinus. That is located in the
frontal bone.
Frontal bone. Ethmoid sinus.
Ethmoid bone.
Ethmoid bone. Maxillary sinus. It is the maxillary bone or maxillae. So out of these 4 bones, 3 bones are cranial bones. What are the cranial bones?
Sphenoid bone.
Sphenoid bone.
Frontal bone.
Frontal bone.
Ethmoid bone.
Ethmoid bone. There's only one bone called maxillary bone or maxillae having sinuses. Clear?
Yes, sir.
In the case of sinuses, you know, okay, this is the way they define. Air-filled cavities lined by ciliated mucous membrane are present in the skull and they are called, what is it? Sinuses. All the sinuses are connected to the
nasal cavity.
Nasal cavity. So air entering through the nasal cavity fill those places. Okay.
Okay, sir.
Right. Sinuses are, you know this word, right?
Yes,
In
sir.
physics, right? Sinuses have air. Okay. When you speak, they are resonating. They give resonance to your voice. Sinuses provide one benefit of sinuses. What is it? Provide resonance to the voice. Another benefit of sinuses,
reduce the weight of the skull.
Reduce the weight of the skull. Understood?
Yes, sir.
Right. So actually with that one, sinuses are over. Here I would have placed a, what is it? Note. Okay. I would have placed a note there. In the note, I have to tell facial region is situated below the cranium. The sternocranium is the upper region face is the lower region. Okay. Some facial bones form the wall of the posterior part of the nasal cavity and form the upper part of the air passage. Some facial bones from the wall of the posterior part. Posterior part means behind. Okay, and form the upper part of the air passage. Maxilla and mandible. You know maxilla and you know mandible. In them only who are placed?
Teeth.
Teeth are placed. Okay, that is maxillae and mandible provide ridges in which teeth are embedded. Upper jaw, that is maxilla, is fused with the cranium. Lower jaw, it is the only bone that is movable. You know palate. Palatine bone I showed you, know.
Yes, sir.
Okay. In front of the palatine bone, in this place, there is a palate. This part is a palate. In this one, there are two palates. One palate is a bony palate. Bony palate. Behind one is cartilaginous palate. Some they say hard palate and soft palate. But that's not our syllabus. Okay. What are the two sides of palates? Hard palate and soft palate. There are some other descriptions are there, hard palate and soft palate, but that's not our problem. So how can I mark this place? Front part, hard palate. How can I mark this place?
Soft palate.
Soft palate. Hard plate is made of bones and soft palate is made of cartilage. Understood?
Yes, sir.
Right. So after printing out the material, label them. Okay. Lower jaw articulates with the cranium. Lower jaw articulates with the, what is it? Cranium. Right? Here, I want to show you two things in this one. Can you notice this place?
Yes, sir.
Yes. So that is the, okay, joint, okay, of articulation of mandible with cranium. Understood?
Yes, sir.
Right. Here, this place is called zygomatic arc. How do you call that one?
Zygomatic arc.
Zygomatic arc. Okay. Zygomatic arc is, wait a minute. Come down. If you take zygomatic arc, this is it is temporal bone. It is which bone? Temporal bone. Okay, this is actually temporal bone. In this side, this is zygomatic bone. So two bones. What are the two?
Temporal bone and zygomatic bone.
Temporal bone and zygomatic bone cordially join and form a unit called zygomatic arc. Understood?
Yes, sir.
Actually, this green color part is called, okay, zygomatic process. The green color part is called, what is it? Zygomatic process. That zygomatic process actually belongs to temporal bone. Understood? In this
Sir.
place, wait, in this place, okay, okay, it is the zygomatic, okay, bone, zygomatic process joint. Understood?
No, sir.
Can you see the now this is now
Sir, my doubt is, what is the difference between zygomatic process and zygomatic arc?
thing
Same
is
thing.
this zygomatic process after joining the zygomatic bone. If now you can, that's what I'm trying to tell you. If you take this one getting separated, this is one bone, this is our temporal bone. Understood?
Yes, sir.
Our temporal bone is this. This is our temporal bone. You can take it out. When you take it out, that green color portion also will be there in it. Understood?
Yes, sir.
At that moment, is it articulating with the zygomatic bone?
No.
At that moment, is it articulating with the zygomatic bone? No.
No.
Sorry. Then it is called zygomatic process. Understood?
Yes, sir.
Right. Zygomatic arc means after it joins, the total arc it makes. In the arc, a smaller contribution of zygomatic bone also will be there. Understood?
Yes,
But
sir.
major contribution is belonging to
Temporal bone.
because the major contribution belongs to the temporal bone. We might think that is normally like what happens in our country, correct? Because the major people are following Buddhism, Sri Lanka becomes a Buddhist country, correct?
Yes, sir.
So majority, the major component that contributes to make the அந்த கார்க்கியை கொஞ்சம் எடுத்து கொண்டு வாங்க, எங்கட தஸ்லீம் வந்திக்குது, கொஞ்சம் எடுத்துட்டு வாங்க. Right? So that is the difference. So after getting this, you have to label these things. Okay. For your further clarification, I am searching this one. What is it? Zygomatic arc. Okay. In the human skull, Okay, if you take a side view, I can take this picture, that is fine. Can you see this picture?
Yes, sir.
In this picture, this is the, what is it? Arc. Understood?
Yes, sir.
நான் கதிட்டேன் ஓகே தம்பி கொஞ்சம் இருங்க என்ன வாரத்தில் கடைப்பிடிகள் ஆறது கழிவுவது right? So up to this one, how do you call it? That is zygomatic process. Arc is the whole thing. Understood?
Yes, sir. Clear, sir.
Then whose contribution is greater in making the zygomatic arc? In making the zygomatic arc, whose contribution is greater? Is it temporal bone's contribution or zygomatic bone's contribution?
Zygomatic bone.
Zygomatic bone's contribution. That depends on your view. Okay, right. You might think zygomatic bone is bigger. Actually, this is our cheekbone. Understood?
Yes, sir.
Cheek. சின்ன பிள்ளைகளை கொஞ்சம் கொஞ்சிற அந்த கொஞ்சிற போன் தானே அப்படி கண் பல மாட்டம் பிடிச்சி கொஞ்சிற இடம் தானே zygomatic bone. ஸ்கல்லா பார்த்தா எவனும் கொஞ்சம் மாட்டான். Okay. So, are you clear? Zygomatic arc.
Clear, sir.
Right. Actually, this is, there are, okay, that's enough. Okay. If you take this one, this is our lower jawbone. Otherwise, we can call it mandible. In the lower jawbone, if you take this place, it is the one that articulates with cranium. Okay, this place that articulates with the cranium, actually in the temporal bone it articulates. Okay, it is called condyloid process. What is the name given?
Condyloid process.
Condyloid process. So condyloid process articulates with the cranium, the joint cranium, mainly temporal bone. The joint they make is called temporal mandibular joint. Okay. And there is another process here that is called by the name coronoid process. Okay. What is written there? It gives attachment to muscles and ligaments. Okay. Muscles, okay, join it to the zygomatic process, or zygomatic arc, okay, through ligaments. Okay, so zygomatic arc is a muscle attaching place. Clear?
Clear, sir.
When you are moving your jaw, open the mouth, close the mouth, open the mouth, close the mouth. That one is done. That one is done by the muscle contraction and relaxation between coronoid process and the zygomatic arc. Are you clear?
Clear, sir.
Right. So, passing this, we are coming to the occipital condyles. I already showed you occipital condyles, correct? This is another way to show them. That's all. Here, this is the bone. This is the bone called atlas vertebra. What is the name of this bone?
Atlas vertebra.
Atlas vertebra. Okay. In the atlas vertebra, in the surface, inferior surface, there will be two articulation facets. Okay, actually, after getting the printout, you can draw this border. It will be like this. Understood? Here, above the border, what is there mean? Above the border, what is there mean? Occipital condyle. Above the border, what is it? Occipital condyle. Below the border, Sariyappa. Okay. Below the border, facet, okay, for articulation. Facet for articulation. In which bone? In which bone?
Vertebra.
In the atlas vertebra. So when you are moving your head up, down, then your skull is moving in this joint. Understood?
Yes, sir.
Right. Thereafter, we come to the, what is it? Which bone?
Temporal bone.
Temporal bone. If you take the temporal bone, in the temporal bone, there are three processes. One process I already introduced you. What is the process?
Zygomatic process.
Zygomatic process. It is joining the zygomatic bone and creating the zygomatic arc. Another two processes are there. One, it is called mastoid process. You can see here in the purple color. It is written as petromastoid. Our syllabus is mastoid process. Another process is here down like a needle, that is styloid process. All these processes have one common function. They provide surface for, what is it?
Muscle attachment.
Muscle attachment. So styloid process also provides surface for muscle attachment. Mastoid process also provides surface for muscle attachment. Zygomatic process also will do it. Same time, it is creating the zygomatic arc. Clear?
Clear, sir.
Right. Actually, this is the resource book diagram, I think. In the resource book, this diagram is there. Do you have the resource book?
Yes, sir.
Second resource book. So, second resource book, no. Second resource book mean part 1, part 2, correct?
Yes, sir.
13. So in that resource book, this picture would be there. Looking at the picture, you one by one label it. Okay. So as I have introduced the bones, now that is not my job to making them label. Clear?
Yes, sir.
Right. So passing the skull portion, I am getting into the next heading. What is it? Vertebral column. Okay. If you take human vertebral column, so you can separate the vertebral column into 26 pieces. What is it? How many pieces?
26 pieces.
26 pieces. That's why your book is telling it is consisting of how many linearly arranged bones?
26 linearly arranged.
26 linearly arranged bones, because it is a collection of bones, okay, arranged one after the other, okay. It is a flexible, rod. Think if the vertebral column is a single bone, then can you perform ruku?
No.
Can you perform sujud? Can you bend yourself? No, everyone can't do that. Understood?
Yes, sir.
So, being a flexible one, strong one, but it's a flexible one. In this, how many bones together?
26.
26 bones. In the 26 bones, 24 are 111 separate vertebrae. Separate vertebrae, how many are there?
24.
24. There is a single bone called sacrum. This sacrum bone is actually a combination of 5 vertebrae, but you can see the 5, but you can't separate the 5. Understood? You can
Yes.
see the 5, but you can't separate the 5. Similarly, there is a small tailbone called coccyx. It is also made of how many? 4 separate bones, but now they are together. That's why they are called fused bones. So how many fused bones are there? There are 2 fused bones there. One it is sacrum, other one is
Coccyx.
coccyx. Clear?
Yes, sir.
Right. In the vertebral column, you can see this. There are 4 regions they divide to. What is this one? Cervical region. Second, thoracic region. Next it is lumbar region. Last it is sacral region. How many region? How many region?
4 regions.
4 region. Cervical spine or cervical region. Thoracic spine or thoracic region. Lumbar spine or what is it? Lumbar region. Sacrum or sacral region. Clear?
Yes, sir.
Coccyx is a very small part, so it's not considered as a region. So region wise, how many regions are there?
4 regions.
4 regions are there. Cervical spine, thoracic spine, lumbar spine, and sacrum. Okay. Here you can see cervical spine is the top part, correct? Cervical vertebra making the cervical spine, it is the top part. In the middle, second place, which spine is there?
Thoracic spine.
Thoracic spine is there. In the third location, our hip region, which spine is there?
Lumbar spine.
Lumbar spine is there. Below the lumbar spine, sacrum is there. As a small tail structure, coccyx is there. Clear?
Yes, sir.
Yes. Cervical mean, cervical mean belonging to the neck. So cervical vertebra mean they are mainly located in the neck region. Understood?
Yes, sir.
Thoracic mean chest. So mainly located in the chest region, that is thoracic vertebrae. In the hip region, abdominal hip region, in the hip region, above the hip, the abdominal region, that is lumbar. Understood? Like this,
Yes.
we can divide the. Why do we want to divide? We will later discuss. Now, when a child is born on this earth, do you have the resource book now in the hand? Do
Yes,
you
sir.
have? Okay. So could you please take this picture?
Okay, sir.
Took it?
Yes, sir.
This picture is there in the resource book.
Yes, sir.
So what is written for the first curve?
Primary curve.
Primary curve. What is it? Primary curve. For an idea, I will overdraw it. I will overdraw the primary curve like this. Understood?
Yes, sir.
So when the child is born, there will be the vertebral column will be in the shape of the letter C. The vertebral column will be in the shape of letter C.
C.
Okay, there will be only one curve there. Understood?
Yes, sir.
Right. Actually, this is helping the child to curve itself and stay inside the small womb. Womb Uterus is a small one, no? Okay. If the child stretches its body, the womb is not enough. Clear?
Clear, sir.
Right. Now, what is marked in the right side? Second picture.
First secondary curve.
First secondary curve. That means this place is curving to this side, curving to other side. Understood?
Yes, sir.
Rest of the curve is remaining as it is. Understood?
Yes,
So
sir.
what is marked here?
First secondary curve.
First secondary curve. Any other name given for that?
Cervical.
Cervical curve. Cervical curve. Correct?
Yes, sir.
Okay. Because cervical curve is created, the child is raising its head. The child is raising its head because of, what is it?
Because of
Formation
the
of the secondary, first secondary curve, that is cervical curve. If you take the primary curve, it is anteriorly concave. What kind of curve it is?
anteriorly concave.
Anteriorly concave. Understood?
Yes, sir.
Right. If it is staying anteriorly concave, then it will be primary curve. If you take the secondary curve, it is anteriorly. Anteriorly mean, okay, front. This is the anterior region. This is the, what is it?
Anterior region.
Anterior region. So anteriorly, from the in the anterior side, it is concave. Anteriorly concave. Posteriorly convex, actually. But if you look at the secondary curve, is it anteriorly concave?
No,
No, it is anteriorly
convex.
convex. So it is anteriorly what is it? Convex. Are you clear?
Clear,
Right.
sir.
What it is written for this?
Primary curve.
Primary curve. Why you are referring that one to the primary curve? It is still anteriorly concave.
Cave.
Correct?
Yes, sir.
Good. So these things you have to mark in the tute after you take the printout of it. Okay?
Okay, sir.
Right. Now come to the last picture. In the last picture, okay, what it is written for the first line?
Anteriorly convex.
It is marked, what is it? Anteriorly, what is it? Convex. Who is marked as anteriorly convex?
First secondary curve.
First secondary curve. Oh, another name?
Cervical curve.
Cervical curve. So cervical curve is anteriorly, what is it?
Convex.
Convex. Okay, I am marking it. So this is anteriorly convex. Okay,
Okay, sir.
right. Second one, what is written here?
Anteriorly concave.
Anteriorly
Concave.
concave. Anteriorly concave, whose nature it is?
Primary curve.
Primary curve. Correct?
Yes, sir.
That primary curve is anteriorly
Concave.
concave like this, correct?
Yes,
And
sir.
what is the name of that curve?
Thoracic curve.
Thoracic curve. So thoracic curve is a primary curve. Understood? Why it is primary curve? It is remaining anteriorly concave like in the beginning, correct?
Yes, sir.
Right. Thirdly, what is written here?
Anteriorly convex.
Anteriorly convex. So if anteriorly convex is coming, what kind of curve it is?
Secondary curve.
Second secondary curve. Second secondary curve is which curve? Lumbar curve. Okay. Second secondary curve is lumbar curve. When the lumbar curve is formed, the child will start to stand in the two legs and will start to walk. Understood? When the lumbar curve is formed only, the child is standing in the two legs and starting to walk. Bipedalism start. And what is written here?
Anteriorly concave.
Anteriorly concave again, correct?
Yes, sir.
Right. And that is the sacral curve. What is the name of the curve?
Sacral curve.
Sacral curve. That you have to mark. Okay. Sacral curve. So if we take cervical curve, let's complete it first. So here the lumbar curve is coming. Lumbar curve is anteriorly convex, posteriorly concave. Sacral curve anteriorly concave and posteriorly convex. So anteriorly what it is enough for us. So two of them are primary curves. Two of them are secondary curves. These two are what kind of curves?
Secondary curves.
Secondary curves, correct? Secondary curves, because they are anteriorly convex, posteriorly concave. And these two are
Primary curve.
primary curves. So two primary curves and two
Secondary curves.
secondary curves are there. Clear?
Clear, sir.
Right. So that is regarding the curvatures in the vertebral column. Right? So primary curve, when the child is born, only there will be primary curvature. Okay. So everything I have explained you. In human, there are 4 curves. 2 of them are primary curves, 2 of them are secondary curves. They are very important for you to maintain an erect posture. Primary curve is in the fetus, only one curve there, correct? Only one curve there, C shape. Secondary curves are created after the child is born, correct?
Yes, sir.
In the after secondary curves are created, primary features will be only in 2 regions. In the thoracic region, there will be primary feature. And in the sacral region, there will be primary feature. That's why we call them primary curves. and they are anteriorly concave. Okay, first what appears is cervical curvature. That is the first secondary curve that appears about in which time period? 3 months of the birth. Okay, the child will be holding its head upright. Second, in a time of nearly 7 to 8 months, the child will be developing the lumbar curvature that will be helping the child to stand upright. Then it can walk. Clear?
Clear, sir.
In a typical vertebrae, actually, as typical vertebrae, we take lumbar vertebra. Who is the typical vertebra? Lumbar vertebra. This is actually the picture of a lumbar vertebra. Do you have this picture in the resource book?
Yes, sir.
Yes. One by one, tell me, what is this?
Body.
Body. We call it body. Some books write it as centrum, but our syllabus is body. What is this canal? This canal.
Vertebral foramen.
Vertebral foramen. Through that vertebral foramen, okay, vertebral foramen, vertebral column travels. Through the vertebral foramen, who travels?
Vertebral
column travels. What is the name given to this process?
Transverse process.
Transverse process. How many transverse process there? Look at the picture and tell me.
2.
2 transverse process there. And how do you call this one?
Spinous process.
Spinous process. Spinous process. How many spinous process there? 1 spinous process there. What is the name given to this?
Superior articular process.
Superior articular process. Actually, superior means above. What is it? Above. Actually, this is a superior view. Which view it is?
Superior view.
Superior view. If you see it in the inferior view, you will notice another pair of articular processes called inferior articular processes. Clear?
Yes, sir.
So all these are, they are in a vertebra. All these are, they are in a basic vertebra. Typical means basic vertebra. Understood? A
Yes,
basic
sir.
vertebra has a body. It has 2 transverse process, 2 superior articular process, 2 inferior articular process. Okay, and that's a spinous process. Remember, here if you take this whole portion all together, it is called a neural arc. What is the name given?
Neural arc.
Neural arc. Think it is a neural arc, okay, plus a body. A neural arc plus a body equal to a vertebra. Understood?
Yes, sir. Sir.
Everything.
Neural.
Other than in the neural arc, everything will come. Transverse process, spinous process. I can't draw all together. That's I have drawn like this. Okay. Transverse process, spinous process, superior articular process, inferior articular process, everything will come under neural arc.
Sir, my doubt is vertebral arc and neural arc is same.
Vertebral arc and neural arc is same. Okay. Your book is written vertebral arc.
Yes, sir.
It can be called vertebral arc.
Okay, sir.
Okay, it can be called neural arc or vertebral arc. So body plus neural arc is making the, what is it?
Vertebra.
Vertebra. Here, if you take this vertebral foramen, this part is made by the body. This part is made by the neural arc or vertebral arc. Clear?
Yes, sir.
Right. So like that, you have to understand the basic parts of the vertebra. So vertebra can be, okay, or what it is written. The lumbar vertebra is the typical vertebra. What we have, you have been given here is a lumbar vertebra. We don't see it at the moment it as a lumbar vertebra. We see that one as a vertebra. Okay, vertebra mean which features should be there. I mean these features should be there. Example this. Clear?
Clear, sir.
Right. So basically they are dividing the components in it to body and what is it? Vertebral arc. So as I told you, it can be called vertebral arc. It can be called, what is it? Neural arc. But if the resource book is using, so actually I'm not memorizing. I'm memorizing the subject. Understood? And I don't keep a tute also in my hands. I just what I can remember, I'm speaking. That is how I'm doing these lessons. Right? So in my mind, it is signatured, it is neural arc. So if they have changed the word to vertebral arc, okay. Body is the largest part, broad part, flat part. Okay. If you take a vertebra, if you take a single vertebra, or if you take a lumbar, what's it? Vertebra. Come. I need a side view. Give me a minute. Yes. Stay for a minute.
This master session is about
Right. So this is the lumbar vertebrae, original. Okay. What you can see here, this is that is the body. So rest is going to be the vertebral arc. In these places, the vertebral arc join the body. Agree?
Yes, sir.
vertebra. Just like all other vertebrae, a typical lumbar vertebra has an anteriorly placed body, also called as the centrum, and a posteriorly placed vertebral arch or the neural arch. Between them, we have the presence of the vertebral canal or the vertebral foramina through which the spinal cord passes. The body is large. It is wider from side to side than from before backwards. The height of the
You
body
can see
is like
you can see it like this. Okay. In this one, the body compared to others, body is very stronger. Okay, very thicker.
more
full
on
of
the
bones.
anterior aspect than on the posterior aspect, and this creates a nice convexity.
Can you hear what he is speaking? Can you hear
Yes,
what
sir.
what he is
Yes,
speaking? Can you hear it clearly?
Not much clear, sir.
Okay. Now see whether you can hear clearly.
This master session is about a typical lumbar vertebra.
Is it clear now?
Yes, sir.
Just like all other vertebrae, a typical lumbar vertebra has an anteriorly placed body, also called as the centrum, and a posteriorly placed vertebral arch or the neural arch. Between them, we have the presence of the vertebral canal or the vertebral foramina through which the spinal cord passes. The body is large. It is wider from side to side than from before backwards. The height of the body is slightly more on the anterior aspect than on the posterior aspect, and this creates a nice convexity of the lumbar spine. The vertebral foramen present between the body and the neural arch is roughly triangular in shape. It's bigger in size as compared to the thoracic region, but smaller than the cervical region. These are the pedicles. The pedicles are pretty small, but they are stout structures, and they are placed more along the superior margin of the body. And as a result, these notches which are formed inferiorly are bigger than the notches which are formed superiorly. So the inferior vertebral notches are much deeper than the superior vertebral notches in case of a typical lumbar vertebra. The lamina, as we can see here, are short, thick, and broad, and they are directed backwards and medially. They join in the midline to form the spinous process. The spinous process is more or less a thick quadrangular piece of bone which is pointing backwards and slightly downwards. The posterior and the inferior border of the spine is thickened. The transverse process, as we can notice here, are very thin and tapering structures, and they are directed laterally and slightly backwards. They are almost similar to the ribs in the thoracic region, and they are more or less an accessory process here. Two articular processes are present, superior articular process and inferior articular process. As you can notice, the superior articular processes are placed slightly wider, and the inferior are placed slightly closer to each other. The superior articular process has these facets for articulation with the vertebrae above it. This is a slightly concave facet which faces medially and backward, and it forms the synovial joint with the superior vertebrae. Similarly, the inferior articular processes have facets which are more or less convex in shape, and they are facing laterally and slightly forward.
Are you clear?
Clear, sir.
So actually what he pointed is little too much than what is in our syllabus. Okay, he told about the lamina, pedicles, but they are not in our syllabus. Okay, what we have to understand. That's all. Okay, body is the largest part, broad part, flat. It's flat. When you see from the top, it is flat. When you see from the bottom, it is flat. It is actually a cylinder, correct? It's actually a cylindrical shape one. The flattened surface of the body, which each vertebra articulate with the corresponding surface of the adjacent vertebra, so that the vertebra are stacked one on the other. One body. Above that body, there will be an intervertebral disc kept. On that one, the other body is kept. Then above that one, an intervertebral disc kept. Above that one, another body is kept. So who is this material staying between next coming? Intervertebral. It's a fibrous connective tissue. A fibrous connective tissue does that one. Okay, fibrous connective tissue. Right? Shock absorbing material. It's a shock absorber. It will be keeping the vertebral column, vertebra away from each other. So there will be a flexibility. There will be a flexibility. Okay. In the more flexibility will become given due to the presence of intervertebral disc. Okay. You know, vertebral foramen is there. Vertebral foramen is made. Okay. One side vertebral arc or neural arc is closing it. One side body is closing it, and it is a root for the spinal cord. He was telling little too much about it. When you go for those kind of videos, little going above a limit will be very common. Okay, your book is using this word also. Processes arising from the neural arc, vertebral arc, your book uses, neural arc also your book uses. There are two processes, there are several processes there. There are two, what is it? Transverse processes, one spinous process, two superior articular surfaces, two inferior articular surfaces. Among these, transverse process, spinous process are four which work.
Muscle attachment.
Muscle attachment. In the superior, inferior articular surfaces, superior articular surface will articulate with the inferior articular surface above it. Understood?
Yes, sir.
That's what you can see in that video. Okay, in this video, when he was placing the two vertebra one on the other, this is the superior articular surface. This is the above one's inferior articular surface. So they are articulating, they are meeting with each other. Clear?
Clear, sir.
Right. So that is the place we are today going to stop the lesson, right? So we will continue from that place. We have to speak about cervical vertebra, atlas vertebra, axis vertebra, thoracic vertebra. This chapter will be quickly finished. Okay. Inshallah, we'll meet. Okay. You also will get I will share the video in the group. You also will get it, refer it and label. First take the printout of the tube, then do the rest. Okay. Bye. Assalamu alaikum.